Let us see why post-Burns neck contractures and post-Burns axillary contractures should not be operated together. Now, one of the general reasons can be each of these cases are individually challenging. They require careful planning, precise techniques, complex reconstructions, maybe flaps or grafts, and addressing both these areas in a single surgery, especially in complex cases, increases the operative time, increases the blood loss, thereby increases the risk of complications like infection, bleeding, and anesthesia related issues. But specifically from plastic surgeon's point of view is we need to give positions in the post-operative period after contracture releases. We need to give splints to the patient after contracture releases. And when neck and axilla contractures are released together, neck needs to be sort of splinted in a position of extension, and axilla needs to be splinted with an aeroplane splint with a position of around 100-110 degrees of abduction. So neck extension and abduction splints don't go well together. It becomes difficult for the patient to keep the neck splint as well as the axillary splint together. That is why neck and axillary contractures should not be operated together. Having said that, it is not a dictum, it is not a rule. Now in certain areas where you might get away with a Z plus T for a neck contracture and there is no need for splintage, or you can get away with a Z plus T or some sort of a local flap without a skin graft for an axilla and you don't need splintage. Under these scenarios, you can always operate neck and axillary contractures together. So it is important to understand the principles as to why neck and axillary contractures should not be operated together.